Assalamu alaikum. It's Muhammad Mosliuddin from Chittagong Medical College, MBBS 59 batch. So today we will discuss about the mitral regurgitations. In my previous lecture, I have discussed the causes of mitral regurgitations, and I have tried my best to explain the all of this underlying pathways that leads to mitral regurgitation. So today I will discuss the consequences of mitral regurgitations on our heart. Okay, so the textbook is Cooper and Clark Clinical Medicine, a very interesting and a very nice textbook. Okay, I think so. So let's start. ربي زدني علما ربي اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. Okay, so I have already told you that the mitral regurgitations means whenever your heart contracts or systole, the blood goes back from the left ventricle to left atrium. Okay, so again I want to briefly recapitulate it. That is, suppose I just only drawing the left side of your heart to avoid the complexity. Suppose this is the left ventricle, and here you can see this is the mitral valve, and this is the annulus of valve. Okay, so we can see here that this is the left ventricle, and this is the mitral valve, and here the above chamber, this is the thin walled chamber, and it is known as the left atrium. Okay, fine. Suppose the ventricle, the left ventricle is now contracting. Okay, so for our easy understanding, I am drawing the aortic valve also. Suppose okay, so for our easy understanding, I have drawn the aorta is the downward. Okay, but it is not the actual location of aorta. Okay, we know that. Okay, fine. So suppose the left ventricle is now contracting. That means the blood from left ventricle will go here, the aorta. Okay, during the systole of left ventricle. But as the mitral valve didn't close completely, so when the left ventricle will contract, some blood will go backwardly from the left ventricle to left atrium. So this is known as the mitral regurgitations. Okay, so what will happen then in next cardiac cycle? Suppose 10 ml, okay, 10 ml blood have come into the left atrium from the left ventricle. Okay, but it shouldn't be there, but accidentally, due to mitral regurgitation, this 10 ml of blood have come from the left ventricle to left atrium. But in next cardiac cycle, what will happen? In next cardiac cycle, the left atrium will also receive blood from pulmonary circulation, but because it is habitually happened, because the left atrium normally gets blood from the pulmonary circulation, and suppose it is 50 ml. Okay, but what is the actual amount of blood in left atrium right now? This is this 50 ml plus the backward blood 10 ml. So our total amount of blood in left atrium right now is 60 ml. But it should be only 50 ml. But here the 10 ml is extra blood. So So in that case that means during mitral regurgitation our left atrium will face the volume overload. Okay, volume overload, because it is getting extra amount of blood that it shouldn't be in normal situation. Okay, now one line we should always remember, that means in case of pressure overload there will be concentric hypertrophy, and in case of volume overload there will be eccentric hypertrophy. So I have already described this is for many times in my previous lecture series. This is what is the concentric hypertrophy and what is eccentric hypertrophy. Okay, so again I want to recapitulate it for a brief time. That means what is concentric and what is eccentric. Okay, suppose this is the left atrium. Okay, only the left atrium, and now again I'm drawing the left atrium. This is the left atrium. So what can you see there? The volume of left atrium is decreased here. The volume of left atrium is decreased here, and the wall thickness is increased. Okay, in relative to this picture. Yes, this is called the concentric hypertrophy. This is called concentric hypertrophy. Okay, that means in case of concentric hypertrophy, the cavity of a heart chamber will decrease and the wall thickness will increase. Okay, in eccentric hypertrophy, what will happen there? Yes, again I am drawing this atrium here. What can you see there? In relative to this picture, here you can see the volume is increased because the cavity is now more enlarged, but the wall thickness also decreased. That means this wall is more thin in relative to this picture. Okay, so in case of eccentric hypertrophy, the volume will increase but the wall thickness will decrease. Okay, so when will happen concentric hypertrophy? I have said you just prior to this lesson, this is pressure overload. And when will happen the eccentric hypertrophy? In case of volume overload. So what is happening in mitral regurgitation? Volume overload. So what will happen, concentric or eccentric? Eccentric hypertrophy. Okay, fine. So what will happen there? In mitral regurgitation there will be eccentric hypertrophy. That means gradually the volume of left atrium will increase but the wall thickness will decrease. And interestingly, here the cardiomyocyte mass, that means total mass of cardiomyocyte will increase. So you can think that I'm telling that the wall thickness will decrease but the cardiomyocyte mass will increase. This seems too contradictory. No, this is actually an interesting thing is happening there. I'm trying to elaborate it. Suppose these are some cardiomyocyte. I have drawn there some cardiomyocyte. Okay, so how many cardiomyocytes are there? 1 2 3 4 5. Okay, now again I have added more 5 cardiomyocyte there, and these are okay. So what will happen here? You can see the wall thickness is increased. Okay, wall thickness is increased because prior to adding the extra cardiomyocyte the wall thickness was this. Now the wall thickness is this. Okay, so this is known as concentric hypertrophy. But in case of eccentric hypertrophy, and how many cells are there? There is 10 cells. Okay, but in case of eccentric hypertrophy, the orientation of cell will be different. What is that? That is, now I'm adding the extra cardiomyocyte here. Okay, and so the wall thickness isn't increased, but the volume is increased. Okay, so due to the alignment or orientation of cardiomyocyte, there is happening concentric or eccentric. But in both situations, that means in case of concentric hypertrophy, there will also increment of total cardiomyocyte mass, and in case of eccentric hypertrophy, there will also increment of cardiomyocyte mass. But whether the volume of heart chamber will be increased or decreased, this is depend on concentric or eccentric. Okay, that's fine. So we know that in case of mitral regurgitation, there will be left atrial enlargement due to volume overload. So what will be the ECG picture? Yes, according to your conception, you know that if the cardiomyocyte mass is increased and there is happening left atrial hypertrophy, not right atrium, left atrial, because our case is mitral regurgitation and this is located on left side of your heart. So there is happening left atrial enlargement. That's why you will get bifid P wave, and it indicates that left atrial enlargement, okay, in ECG pictures. So this is our finding. So let me know an answer that whether will there be any hypertrophy in left ventricle in case of mitral regurgitations, because you are saying that the left atrium is getting extra blood, but we cannot see the left ventricle is getting anything extra blood in there. So whether will there be any hypertrophy or cardiomyocyte changes in left ventricle? Definitely. This is another interesting things. So let me explain it. Suppose I'm drawing again the picture. So already we can see the left atrium is enlarged. That means here already happened the eccentric hypertrophy. Now one thing you should consider, that suppose the left ventricle is contracting and some amount of blood goes backwardly. Okay, fine, and this extra blood is accommodated here, but in next cardiac cycle, that means when the left ventricle will undergo diastole, that means when the left ventricle will be dilated, then what will happen? This backwardly blood again enter into left ventricle. So normally, suppose so we will compare these two diagrams. So normally 50 ml blood is received by left atrium from pulmonary circulation, and during the diastole phase, this 50 ml blood will enter from left atrium to left ventricle. Okay, but what is happening in mitral regurgitations? This 50 ml blood will enter, as well as the backwardly going 10 ml extra blood will also enter with this 50 ml blood. So that means in case of mitral regurgitation, the left ventricle is receiving 60 ml blood during diastole. So gradually the left ventricle also will face the volume overload. Yes. Okay, so initially the left ventricle will compensate it, but gradually whenever the mitral regurgitation severity will increase, the backwardly going amount of backwardly going blood will also be increased. That means here the 10 ml blood is replaced by 20 ml. That means now 20 ml blood is going backward during ventricular systole, and this extra 20 ml blood again come into left ventricle in diastole phase. So that's why your left ventricle will also face volume overload, and due to this mechanism there will be also eccentric hypertrophy in your left ventricle. So we also know that whenever eccentric hypertrophy will happen in left ventricle, the contractile capacity, that means the contraction force of your left ventricle, will fall down. That's why what will happen, if your left ventricle cannot contract forcefully enough, then your ejection fraction will fall down. Your ejection fraction will decrease. Yes, that's why in advanced stage the ejection fraction will begin to decrease in case of mitral regurgitation, and actually at that stage patient present to us with complaints such as fatigue due to decreased cardiac output. Okay, yes, and now I am showing you the lesson. Here you can see, yes, look at the lines, fatigue and lethargy. Why this fatigue and lethargy is happening there? Due to reduced cardiac output. So now you can realize that why reduced cardiac output is happening in mitral regurgitation. Reduced cardiac output will not happen at initial stage of mitral regurgitation. So when will it happen? When, due to this gradually volume overload on your left ventricle will undergo eccentric hypertrophy, and gradually the contracting capacity of your left ventricle will decrease, and that's why the left ventricle cannot pump the stroke volume adequately. That's why your cardiac output will start to decrease, and at that time the patient will face fatigue or lethargy. Okay, fine. Okay, now I will explain the next symptom, why there is happening dyspnea or orthopnea. This is just same like as the mitral stenosis that I have discussed in my mitral stenosis lecture series. Okay, but again I want to recapitulate it briefly. So I think all of you can already get the mechanism. So I have told you that there is happening the venous, the blood congestion in the left atrium. Okay, left atrium. Suppose and this is the mitral valve. Okay, and this is the lung bed, two lungs. Okay, so I have drawn here only left side of your heart to avoid the complexity. So due to mitral regurgitation, your left atrium is facing volume overload. That means more and more blood is now in left atrium. Why? Because some blood continuously going backwardly from left ventricle during systole. Okay, so the pressure within left atrium will increase. Why? Because more blood is coming in left atrium now due to this back flow of blood. Okay, so now the pressure in left atrium is more. That's why the oxygenated blood from lungs cannot come easily from the lungs to left atrium through pulmonary vein, because the tendency of blood is going forwardly from the high pressure to low pressure, and normally the pulmonary in lung bed the pressure is more, and in left atrium the pressure is less. That's why blood is coming from lungs to left atrium. But due to this backflow of blood, now the left atrium contains more blood, and the pressure is more, and the pressure is increasing in left atrium. That's why the blood cannot easily come from the pulmonary capillary to left atrium. Okay, so what will happen? The blood will begin to accumulate in the pulmonary capillary. So the blood will start to accumulate it here in lungs, in pulmonary capillary. So there will be pulmonary venous congestion, and later this pulmonary venous congestion will lead to pulmonary hypertension, and this pulmonary hypertension will lead to right ventricular hypertrophy, and this will lead to the right heart failure. So right heart failure also be happened due to or as consequence of mitral regurgitation. But what is the first symptom there? The pulmonary venous congestion, and this pulmonary venous congestion will lead to dyspnea, breathlessness, because this pulmonary venous congestion will hamper the gaseous exchange in your lungs. That's why patients will suffer from dyspnea, breathlessness. Okay, so this is the cause of dyspnea or breathlessness. Okay, so alhamdulillah, I have already explained why right heart failure will be happen in mitral regurgitation, so you can easily understood that. Okay, thank you everyone for being connected with me, and keep me in your prayer.